and welcome to my week 4 informative speech assignment. So for this week's assignment, I chose to do my informative speech on PTSD, post-traumatic stress disorder. For my assignment today, I'm going to do a little bit of a layout. We're going to talk a little bit about what PTSD is, some of the facts about it through research and studies, a quick overview of signs and symptoms, as well as some treatment options, and the do's and don'ts that you as a loved one can learn more about and adhere to help benefit the person in your life that suffers from PTSD and to keep the connections closer. I've got a couple of sites that I'm going to quote from, some of the sites that I went on to research this myself, which is www.helpguide.org, www.ada.org or adaa.org, www.ptsd.va.gov, and www.mayoclinic.org. The first one is probably my favorite. I felt the information was probably the best and the most forthcoming of what I know of PTSD to be true. Now, one of the reasons that I chose this subject is because though I personally don't suffer from PTSD, it has played a big role in my life with several of my loved ones. One of the reasons that I chose to become more informed of this topic is that I recently became very close to someone who suffers from PTSD, and this individual is extremely important to me in life and very, very close to my heart, someone that I want to keep my ties with. And I realized that the more time I spent with this individual, though I didn't know he had PTSD from the beginning, I started to notice the signs and the symptoms a lot more. Now, he did openly admit to it. He wasn't trying to hide it. He didn't make a secret of it. But when I noticed the signs, I noticed the symptoms, I didn't really know how to deal with them. And I didn't really know sometimes if they were part of the PTSD or just parts of his personality in general. So I wanted to learn more. So what PTSD is, of course, we all know, is a medical condition that can occur after one experiences or witnesses a traumatic event in life. So those are issues like mass violence, being in combat, serious car wreck, whether you're in it, you witness it, the sudden death of a loved one. Of course, you have rape, assault, any event that leaves someone feeling hopeless or helpless. A few facts about PTSD that I actually didn't know is that 7.7 million Americans 18 or older have PTSD. 67% of people exposed to mass violence have been diagnosed with PTSD, and that's a higher rate than anyone from any other traumatic event. Natural disasters and mass violence are the top causes of post-traumatic stress disorder. Now, a few of your signs and your symptoms are re-experiencing the traumatic event through ways such as flashbacks, nightmares, going to an activity or a place that triggers something in your mind that brings back the time that you went through the event or things that happen immediately following it. Another one is the avoidance or the numbing. So avoiding those activities, those places that you once loved, loss of interest in your life or activities in general, just kind of wanting to be alone, not wanting to be around people, not wanting to do anything, closing yourself off, which is a part of the feeling detached symptom. It's the sense of wanting to be alone, the fear of getting hurt if you do something, the fear of being out of control of something. So if something bad were to happen, you have no control. It would trigger that traumatic event in your mind and really bring on an episode of the PTSD. Increased anxiety, I think, is probably one of the biggest ones I've ever noticed. So that's feeling jumpy, irritable, angry, difficulty sleeping, having panic attacks. These are all signs that you're going to see with someone who carries PTSD in their life. So common symptoms, of course, self-blame, guilt, shame, distance, closeness, hypervigilance, which is being on constant red alert. A few risk factors that people don't realize they might have when they start to develop PTSD or go through a traumatic event is a family history of depression or a family history of PTSD. If these are a part of your life, you could potentially develop it. So, get yourself checked. Don't be afraid. Don't ask, don't hesitate to ask those questions. If you feel you're at potential risk for PTSD, get informed and, go get the help that you may or may not need. High levels of stress in everyday life, lack of coping, and lack of support after your traumatic event are really high risk factors to lets you develop PTSD. And it could take weeks, it could take months, and of course, with some people, it's something that takes years before they develop it. But definitely signs and symptoms to watch for. Now, of course, there's treatment options. So there's behavioral treatment to help you keep control of these things and to help you eventually maybe get past the PTSD. There's therapy options. There's group therapy for the individual. There's family therapy so that you're not shutting your loved ones out. You're not making them feel like you don't want to be there. You're not hurting them. You know, one of the biggest factors in my life with PTSD is not getting the family therapy, or my loved one not getting the group therapy or the proper treatment. So they don't realize the impact that they have on you when the PTSD really takes over. They don't realize the pain that it may cause to you, or, you know, they don't feel responsible for what they've done because of the PTSD. So definitely therapy. And of course, there's medications, we all know, pills that you can take, prescriptions you can get to help with the anxiety and the stress, to kind of rebalance the part of your brain that's been chemically offset by the traumatic event. Common feelings, actions that a lot of people don't really take for anything more than normal everyday behavior are things like anger, violence, major issues with trust, overprotectiveness, being demanding, because they feel out of control. They don't feel that they can help the situation, and they don't feel like they can prevent a traumatic event that they've been through or a future traumatic event. So hypervigilance, again, being on constant red alert, severe anxiety, panic attacks. These are all signs that if you notice frequently, and you notice them on a regular basis at a high amount, you definitely want to maybe look into post-traumatic stress disorder being the cause of this, and maybe even yourself, but definitely a loved one. You know, they don't always want to ask for help. They don't always want to look for it. So ways that we as loved ones can help, and this is one of the biggest reasons that I researched PTSD, one of the biggest reasons I looked into it, is how to better help the loved one in my life that deals with this every day, and how to better know what I am and I'm not doing wrong to maybe trigger the PTSD. Listen to your loved one. When they want to talk about something, listen, and listen very, adherently. Pay a lot of attention, but don't push them. Don't push for details. Don't push for trigger signs. Listen, be attentive, but don't be demanding on answers and responses. Ask a question. If they tell you something and they open up to you, but you don't understand what they're saying or you don't understand what they mean, don't be hesitant to ask questions, because you want to understand what you're being told so that you know how to better deal with it and not push that subject open. Don't ever second guess or give advice to the individual. If they come to you and they want to talk, let them talk to you, but don't give advice to them. You don't know how they feel. You don't know what they're going through. You don't know what the PTSD makes them think or want to do. So don't second guess a thought or a feeling that they have, and don't give them advice. Just be there and be an open ear and a trusted person in their life that they can come to. Most importantly, more than anything to me, is be informed. Know what PTSD, know how it works, know what it does. Know as much as you can. Know the signs, know the symptoms, know the treatment options. There's self-help tips. There's a lot of different things that you as an individual that doesn't have PTSD can do to better support, provide, and be there for your loved one. One of the most important things to remember when your loved one comes to you and talks to you, opens up to you, or really starts to seclude themselves from you, is never hesitate to ask for help. If you feel they're in danger, if you feel they might hurt themselves, never hesitate to call for help. Call another loved one. Call someone who knows more about PTSD. Get a hold of someone who can help them the way that they need it if you don't feel that you can do that, but you feel they really need it. Because sometimes they're afraid to ask for that help. One of the biggest things that I've learned about PTSD over the course of the few weeks that I've really been dealing with it, and that I learned after researching it more, is don't allow your loved one to use it as a cop-out or as a crutch. A lot of people with PTSD will lean on it. And when they can't do something right or they do things wrong repetitively, they lean on it. Be understanding that maybe they don't realize they're doing that, and find a way to address that with them so that they don't feel that you're attacking them, but that you're there to help them. One of the best phrases to attach to PTSD that I know of is, a lot of people that suffer from it use the fight or flight response. When they feel like they're backed into a corner, either they want to get angry, they want to get aggressive, they want to be argumentative, and they want to defend themselves, or they just want to flee the situation and leave it be. So fight or flight is something to really take into mind, and how you as a person would react if put into a situation where you felt that that was your option. So be informed, really know what you're doing. It's definitely going to make it a lot easier, and it'll prevent a lot of the problems that you'll have with the strain on a relationship, whether it's your loved one, your spouse, your family member, a close friend. Like I said, I personally researched this information because someone that I love very dearly, someone who means a lot to me, deals with this every day. And I felt that for me to be there and be there for that person, I needed to know more about what it's like inside of their head to the best of my ability. And it is a very scary place. And it is very confusing at times. So hopefully this gives you a better idea of what post-traumatic stress disorder is like for an individual who goes through it, and a better idea of how you as an individual can be there for your loved one, be informed, and be helpful. Thank you very much.